Lo frustrante de ahí es que nada más te dan el diagnóstico en papeles, pero no te dicen qué hacer. No te dicen, te recomiendo aquí, no te dicen, habla con esta familia, aquí está tu niño, aquí está el diagnóstico.
Es una experiencia muy parecida a cuando se pierde un ser querido por una muerte. Siente uno que se le va el niño y atraviesa uno por un duelo. Él lleva el luto, lo lleva por dentro uno, porque aún teniendo al niño ahí, lo único que piensa uno es en lo que se pierde. Nunca se acuerda uno de lo que todavía tiene ahí.
Se me quedó muy grabado esto porque fue lo que nos dio ánimos, que dijo, déjalos que vayan a tu casa y que lo evalúen, y si algo está mal, que haya intervención temprana.
Autism is a disorder that has a set diagnostic criteria, meaning that when you take your child to the doctor to be diagnosed, there is a book, literally a book that they read through, a list of symptoms, and the child needs to meet 2 symptoms within the category of stereotypical behavior. One, and then 2 symptoms for social impairment and 2 symptoms for language impairment. So you need those 5 things at some level to be present to have a diagnosis of autism. So if you wanted to define it as, in a nutshell, it would be a developmental disorder that affects the social, language, and areas with some onset of behaviors, stereotypical behaviors that can range from staring at specific objects to hand flapping to reciting movie scripts. So it can be tricky to diagnose sometimes, and even with the diagnostics manual like the DSM, you have overdiagnosis and underdiagnosis. But the definition is there. So
no, around the age of 18 months, we saw a difference. He became like, he kept wanting to be by himself in the room. The first signs were he would line up 50 of his cars because he's in 2 cars. So he would line up 50 of his cars. If I were to move one, he would notice it, and because he wasn't verbal at that time, he would grab my hand and make me go through the whole house looking for that one particular car.
Autism needs a little bit more steps broken down and things like that. So they are normal, they are okay. They just need a little bit more help to learn their social skills, learn their language skills, and learn any kind of bathing, eating, feeding, whatever it may be.
La vez que noté yo que Juanito en lugar de andar jugando como los otros niños con juguetes, lo que prefería era estar acostado boca abajo en el piso. Y eso es lo que gusta, y no en la alfombra, en el piso, le gusta. Entonces, cuando viene el diagnóstico de la doctora, ya una semana después, ¿no? Pues que ya nos dijo que Juanito tenía un nivel muy alto de autismo severo, lo que nos dijo ella.
Like going to the movies is an example, because if the movie is too long, or if it's not really animated, he'll start like making loud noises or laughing when, you know, supposedly he shouldn't be laughing. And then I have other people telling me, well, you know, can you tell your child to be quiet? Or doesn't your child know how to behave in the movies? You know, haven't you educated your child when they don't understand that, you know, if I could do that, I would.
Autism used to be 1 in 100 children would get autism. And now the numbers are at 1 in 88 children would get autism, 1 in 54 were boys, and 1 in 252 were girls.
When you have children, you know, your hope is like, I want them to go to college, get a career, get married, have a family. Those are your hopes as a parent with typical kids. Now with Steven, my hopes are that he can drive a car, that he can make his own sandwich, that he can do independent things. You know, if he gets a job, that would be great. I could talk to the community and ask them for one thing, that would be it for them, like not to stare and not to come and give you parental advice and judge you. because they don't know. They don't.
It is difficult to deal with. Everyone needs to just be patient, and there is help out there to get the right steps on how to teach their child to work, how to teach their child to just cope with everything else that's going on. So please be patient and know that there are people out there that really want to help. It's just difficult to find them, and you can do that by looking it up on the internet or whatever it may be. Just be patient and everything will be okay. When you meet one person with autism, you've met one person with autism. No individual with autism is the same.